understands that they will be responsible to cover the difference.
Right.
Usually for coverage, for knowledge, and just because the client usually doesn't know what they're covered for. And every insurance is different.
Do you have any experience obtaining authorizations?
Yes, I've worked for, it was very much in dental, but getting authorizations or calling other primary cares, usually the current or former general practitioner to release records, getting authorizations for surgeries, or just, sharing of documentation.
What techniques or resources did you utilize?
Software, fax, calling. I always try to keep an open door policy with providers that are referring to each other. Speaking as a patient, if my providers don't talk to each other, usually I try to find other providers that do talk to each other, and just being transparent, open, and working on behalf of patients for the best care.
What's your favorite part of this type of position in this work?
I like working with doctors. Being up front, I obviously have to call insurances, call patients, but I always like working with doctors, with treatment plans, and kind of being the interim person between a provider and a patient, making the doctor look great, and usually trying to work between patients and doctors.
So, do you have any questions for us?
So, is it a full-time position?
It is.
Okay. And I would be working like in this location, in this nice little hospital?
Yep, and so we are not part of the hospital, we're independent.
Okay.
And we only do 2 modalities, PET CT and CT. So it's a quieter office, although there's plenty of work to do, but I'll let Mackenzie speak more to all of that.
Yeah. So our radiologists aren't in office. Most of the in-between our rads and like the patient care goes between the tech and the rad. We deal a lot with referring offices, so referrals that come to us. Let's see, we do 2 modalities. There's a total of 3 people usually in the office, so a lot of the work that you do would be up front for scheduling, possible records, trying to obtain records. They'll be creating that relationship with the referring providers, really, and doing just a lot of direction, I guess. Trying to find my words to explain it.
You definitely have to be self-motivated.
Yeah.
So, because you're kind of a one-person show.
Yes. So it'll be just you and the tech, really, and then we have myself that will be back here that can provide assistance. I'm trying to think. What else?
It's very much a team here because it is small. So they really cohesively move about in the clinic, like whether it's on the phone with providers, with patients,
It's just
with
like
equipment, with IT.
I was like, it's a
All the
mini
things.
community that and family
Yeah,
here.
very much a family here for sure.
Let's see. It's a Monday through Friday position, 8 to 4,
Okay.
and there are possibilities of